The COVID-19 pandemic continues to threaten the economic well-being of Boston's residents, as well as their health. Hi, I'm Russell Shute, Professor of Sociology at UMass Boston, Clinical Research Scientist at Beth Israel Deaconess Medical Center, and co-principal investigator of the study Living in Boston During COVID-19. Our team includes researchers at Northeastern University's Boston Area Research Initiative, led by Dan O'Brien, and UMass Boston's Center for Survey Research, led by Lee Hargraves. The National Science Foundation funded our study to investigate the social impact of the pandemic across Boston's neighborhoods. Our first two reports investigated exposure to risk of infection and influences on risk behavior. In this third public report, we focus on the pandemic's economic impact. Let's take a look at some of our key findings about that economic impact. First of all, we found that more than 1 in 5 Bostonians lost a job after the citywide shutdown in March. By the summer, some of these residents were employed again, but 1 in 5 of those who had been working in March were still not working last summer. On the other hand, about half of Bostonians who were working in March before the pandemic continued to work through the summer, while just over 1 in 10 of those who were not working in March secured a job in April or during the summer. Incomes also suffered. The personal incomes of 4 in 10 residents had declined as a result of the pandemic, and half of these said their income declined a lot. Only 7% said their personal income had gone up as a result of the pandemic. The income loss was concentrated among those who lost a job. Major income loss was also concentrated by neighborhood. In neighborhoods with many affluent residents, like Beacon Hill, Back Bay, the South End, and West Roxbury, few suffered a major loss of income. In some of the less affluent communities, like Mattapan and East Boston, Orient Heights, income loss was much more common. But the neighborhood variation only reveals part of the story. It's no surprise that those who are economically vulnerable already experienced more economic pain. Those who experienced an income loss were much more worried about having money for necessities and much less likely to have as much as $1,000 in savings for an emergency. This pattern of differential economic mobility also was reflected in variation between neighborhoods. Worry about running out of food due to insufficient funds was much more common in communities of color like Hyde Park, Mattapan, Lower Roxbury, and East Boston Orient Heights than in affluent, predominantly white, non-Hispanic communities like Back Bay, Beacon Hill, and Seaport. Income loss was much more common also among those with less education. Almost 2/3 of those with no more than a grade school education lost income during the first months of the pandemic, compared to less than 1/3 of those with a college degree. There were stark disparities in the likelihood of income loss by race and ethnicity. While fewer than 1 in 3 white, non-Hispanic residents lost income as a result of the pandemic, that fraction rose to about half of those who were Latinx, Black, or Asian. Those who completed our survey in Spanish are probably first-generation immigrants. They were twice as likely to report a lot of income loss compared to English-speaking Latinx respondents. However, these Spanish-speaking respondents were also much more likely to report having gained income during the pandemic, perhaps due to taking up a new job. Family status also impacted the likelihood of experiencing income loss as a result of the pandemic. Single parents, 75% of whom were women, were most vulnerable. About half experienced some income loss. Married women without children were least likely to report income loss. So, what have we learned about the increased economic pain during the pandemic? First, that pain was widespread, with almost half of Boston residents reporting some income loss. More importantly, however, this economic pain varied dramatically between neighborhoods and across individuals in a way that exacerbated inequities. Preserving Boston's social health during the pandemic requires attention to economic vulnerability as well as health risk. Economic vulnerability varies a great deal across communities and social groups, and so efforts to help must be targeted as well as intensive. Moreover, the inequities we have identified shape the trade-off we all face between reducing the risk of infection and sustaining our economic resources. In our next report, we will focus on the consequences of economic need for risk-taking behavior.